All right, so let's talk about some disorders, some issues that people may have, and kind of interesting stuff. So, by the way, on page 324, Building Your Vocabulary, it's talks about some prefixes in this chapter that can be really helpful, like adeno, gland, agglutinin, clumping, all other, angio, vessel. It's really helpful to look at that table because if you know those prefixes, then it really can help you master these words. All right, so allergies. What are allergies? It's kind of an overreaction of the immune system to an antigen that normally would not cause any problems. So think about it. People can have allergies to peanuts. People can have allergies to shellfish. A peanut is not going to kill you. It's not a virus. It's not. But for people who have an overreaction to it, right, they can have this allergy. Pollen in the air can cause allergies. So here they show a flower, and here's pollen. So these are these chemicals. They enter respiratory tract. Histamine causes allergy symptoms. So the pollen will bind and to these antibodies, and it's going to cause the mast cell to have a response, releases histamines, and histamines are what cause inflammation. And so, someone can have allergies. They have a runny nose, they have, clogged sinuses, etc. They feel like they're sick, but they're not sick, right? There isn't a pathogen that's causing that. It's an allergen that's causing that, which can be a real drag for people with allergies. Okay, so building your vocabulary, again, it helps to look at that. Anaphylaxis. So if you've heard of anaphylaxis, like anaphylactic shock, so that is, it says unusual, exaggerated allergic reaction to foreign proteins and other substances. So it can be really bad, right? So people who have peanut allergies, right? Well, if they're releasing that histamine and there's too much too fast, it causes all of these problems. Lungs, bronchoconstriction, right? So they're having a hard time breathing. The heart rate can go fast but decrease cardiac output. Vasodilation, edema, swelling, etc., etc. And it truly can be life-threatening. In the book on page 328, they talk about anaphylaxis. This is an emergency condition that requires immediate professional medical attention. Shock can occur as a result of lower blood pressure, blood volume, right? If the fluid's leaking out, the blood volume goes down, blood pressure goes down, and that can cause a problem with the heart. It says hives, angioedema, hives on the lips, eyelids, throat, tongue often occur. Angioedema could be severe enough to cause obstruction of the airways, so now they can't breathe because there's too much fluid in the lungs. Prolonged anaphylaxis can cause heart arrhythmias, so has to be treated. Sickle cell disease, sickle cell. Red blood cells look like this, okay? It's an inherited condition where the hemoglobin, that's proteins found in the red blood cells, the shape is different. And it's like, okay, what's the problem? Well, this is what the problem is. If red blood cells are moving through the vessels, if the shape of the blood cell is different, now we can get blood clots. And if we get blood clots, now nutrients aren't getting where they need to go. And it can cause all kinds of problems, and it can be very painful. It says clinical manifestations of sickle cell result in pathologic changes, structure systems. So here it says is characterized by episodes of acute painful crisis. Sickling, so the cells changing that shape, right? And it's based on low oxygen, okay? So sickling are triggered by conditions causing high tissue oxygen demands or the effect of cellular pH. As the crisis begins, sickled erythrocytes, they're the red blood cells, adhere to capillary walls. So they're going to adhere to capillary walls. causing obstructing blood flow. So if the blood's not going where it needs to go, now the tissues are not getting the nutrients and they can get damaged. Okay. It says the crisis accelerates as tissue hypoxia, so going down in oxygen. Acidic metabolic waste products cause further sickling, cell damage. Sickle cell crisis cause microinfarcts in joints, organs. Repeated crisis slowly destroys organs and tissues. It's really a horrible, horrible disease. Spleen, kidneys are especially prone to sickling. So if the organs aren't going to get the nutrients they need, eventually the organs get damaged. And it's very painful, and it's truly a crippling disease. Autoimmune diseases, they talk about that increase with aging. Erythrocyte, right? That's red blood cell, erythrocyte. Hematoma, that's kind of like an accumulation of blood. That would be a hematoma. So it's kind of like a bunch of blood there. Hemorrhage, internal bleeding, external bleeding, hemorrhage if there's a lot of blood in one area, right? So people can hemorrhage. Here it is. So that's eventually going to be a bruise, but there's bleeding happening in this area, and that's a hemorrhage. Hemostasis. So how do blood cells or how do blood vessels fix themselves? So that's kind of really cool. So things happen, like if bam, someone hits you and you get a bruise, there's hemorrhage, there's bleeding happening there. But the vessels have to fix themselves. So how do they do that? So here's the vessel injury, all right? It will spasm, so it's going to constrict. And then the platelets come in. It says they adhere to injury site, aggregate, form a plug, bam. And then the fibrin come in here, and they form that mesh, and eventually that vessel fixes itself. Yay, go body. Sarcoma, so if you know what that means, we're talking about tumors, we're talking about cancer. Go there. It says malignant neoplasm that causes these vascular lesions, right? And it's AIDS related generally, so that blood is pooling in those areas. Okay, now getting into the lymphatic system, lymphatic problems. This is lymphangitis, inflammation of the lymphatic vessels, and you see that color, that discoloration. Remember, God, doesn't that look horrible, right? It looks very painful. Inflammation, swelling can be very painful. Now remember, the lymphatic vessels are bringing that fluid back up to the cardiovascular. What if the lymphatic vessels are not doing their job? Then fluid pools in the tissues, and then that causes swelling. And again, it's very painful. Here, lymphoma, we're talking about cancer again. Lymphoid neoplasm, so it has to do with lymphatic. It says usually malignant, right? There's non-malignant and malignant. Lymphomas are identified as Hodgkin disease or non-Hodgkin's lymphomas. Radiation therapy is the primary treatment, early stage Hodgkin's. Another type of lymphoma. Okay. Here, if you've heard of mononucleosis, it's caused by a virus. It says infectious disease, swollen tonsil, swollen cervical lymph nodes, high fever, blood. The person feels super duper tired, and they can look at that, and they have atypical lymphocytes. So that's mono. All right, pan, like pandemic, right? Pan is all over. Talking about the coronavirus becoming a pandemic, which the World Health Organization said it's a pandemic. So we see it all around. Site means cell, penia, lack of. Thrombo, we're talking about a clot. Ectomy, take surgical excision, getting rid of that clot. Okay. Sometimes people get clots, deep vein thrombosis, and this picture is showing areas in which that can happen. Sometimes that happens after surgery. A clot clots can form. Sometimes, you know, when people get on planes and they talk about moving around, because if you don't move, blood can pool, you can get clots, and that could be a problem. Here we go. These vessels. I think that's one of the last things that we see here. Inflammation of lymph or blood vessel. So you can see the blood pooling there. Drug highlights, anticoagulants. So they would get rid of clots, hemostatic agents, antianemic agents, EPOs, that has to do with red blood cell formation, other agents. So they have that in your book. Diagnostic tests, really cool actually to look at that. So anti-nuclear antibodies, ANA blood tests to identify antigen antibody reactions. So here with the coronavirus, one of the things they want to find out is, can we create a test where we can look for antibodies, you know, if someone was exposed to the virus, and that way we'll know who's been exposed, who hasn't, and that will affect how people react to other people. Bleeding time, we can look at, you know, how long does it take for blood to stop flowing. Blood typing, very important, though, knowing the blood type. Bone marrow, we can take bone marrow out for different reasons. Cell count, CBC, that's important. You're going to hear that a lot. Complete blood count. So it's hematocrit, hemoglobin, red blood cell differential. ELISA, it's a test, an assay, enzyme linked immunosorbent assay to screen for HIV. ESR, rate blood cells settle. Hematocrit, you hear about hematocrit a lot. Blood test for the whole blood to determine percentage of red blood cells. So how many red blood cells do we have? Hemoglobin, that protein found in red blood cells. Immunoglobulins, right? Those are, right, the talking about the antibodies, right, and looking at them. PPT, platelet counts, prothrombin, right, for blood clotting. RBC, red blood cell count, right, that tells you about the red blood cells, how oxygenated can the blood be. So if people have anemia, have other issues sometimes. Now, viral load, how much virus is in there. Blood tests, white blood cell counts. Again, the white blood cells tell you stuff about infections. Abbreviations, do look at these. These are important, right? So, yeah. Some more abbreviations. And then we are finished with this chapter. I hope you guys are well. I hope your families are well. Please do take a look at this. We will have homework as usual. We will have my lab activities as usual. And again, I'm going to put up some videos because I think it's really interesting in regards to the virus, the coronavirus, and what's going on. All right. See you next week.